Hello, I'm Dr. Maya Chakerian, founder and owner of Sereno Santé, a medical practice and medi-spa devoted to the health and wellness of my patients. I'm doing a series of informational videos on sexual dysfunction and its treatment. Our first video will cover the epidemiology and causes of male erectile dysfunction, more commonly known as ED. Male sexual dysfunction, and in particular erectile dysfunction, is widespread and is commonly associated with emotional stress for both individuals and couples. ED is not an inevitable part of the aging process, but may occur due to illness or as a side effect to medications. Accurate figures regarding the exact prevalence of ED are difficult to obtain. It is estimated complete ED is present in approximately 5% of men in their 40s, 10% of men in their 60s, 15% among men in their 70s, and 30 to 40% in men in their 80s. We can draw from these data that approximately 20 million men in the U.S. have significant problems with erectile dysfunction. We can also conclude that increasing age is a key risk factor for the presence of ED. Conditions such as obesity, diabetes, hypertension, high cholesterol, and vascular disease are all causative factors. These conditions are reaching epidemic proportions in Western societies. The lining of the blood vessels, known as the endothelium, may be the final common pathway of ED. Erectile dysfunction may be the canary in the coal mine as a possible warning of cardiovascular disease. 2/3 of men with hypertension have some degree of erectile dysfunction. More than half of the men with ED who have no cardiac symptoms have an abnormal stress test, and 40% have had significant coronary artery disease when studied. Of men hospitalized for their first heart attack, 64% have had ED for 3 or more years before the infarction. Because ED remains a source of embarrassment for men, they often do not mention this to their doctors when it could be an important indicator of the need for cardiovascular workup. Apart from age, the main risks for ED are vascular. Smoking, hypertension, obesity, diabetes, and lack of exercise can all lead to vascular disease. Other factors can be psychological, including anxiety and depression, which can lead to ED. ED can also be associated with benign prostatic hypertrophy, known as BPH, but we don't fully understand the association. Neurological risk factors include certain nerve diseases, such as multiple sclerosis, and any pelvic surgeries which may lead to nerve damage. Hormonal risk factors are any condition which leads to low testosterone, high prolactin, or low thyroid levels. We've just discussed the widespread prevalence of ED in Western populations. I'm going to cover the health conditions which can lead to ED in greater detail in my next video. Treatment for ED will be covered in subsequent videos. Thanks for watching. This is Dr. Maya Chakerian. See you soon at Sereno Santé.